Welcome to QuickCast Reports. In this video, we're going to provide you with important information and powerful insights about a story that's making waves across the country. The Supreme Court ruling that could change access to Planned Parenthood for millions of Americans. So stick around, we've got the full breakdown for you. Breaking news out of Washington, D.C. The Supreme Court has just ruled that Medicaid patients can't sue to access Planned Parenthood, and the internet is on fire. Google searches are exploding, social media is raging, and millions are asking, what happens next? Stay right here because we're unpacking all of it. So what just happened? In a 6-3 decision, the U.S. Supreme Court ruled in Medina v. Planned Parenthood that Medicaid patients do not have the right to challenge their provider choices in court. Justice Neil Gorsuch wrote for the majority, saying Medicaid law doesn't give individuals the right to enforce who provides them care. On the other hand, the liberal justices, Sotomayor, Kagan, and Jackson, called this deeply harmful, saying it strips Americans of control during vulnerable moments. Let that sink in. Imagine being told you can't choose your doctor. Now imagine that doctor was your only affordable provider for birth control, cancer screenings, or prenatal care. That's what this ruling could mean for millions. It's a serious moment that's causing ripple effects not just in legal circles, but in real lives. Let's talk about Julie Edwards, a woman from South Carolina who sparked this case. Julie is a low-income patient who relied on Planned Parenthood for her reproductive and general health care. She has diabetes. She couldn't afford to go anywhere else. Julie and many others were blocked from accessing care when the state tried to defund Planned Parenthood, even though the clinics had committed no wrongdoing. This isn't just a court case. This is about real people like Julie being caught in political crossfires. And while the ruling focused on law and constitutionality, the human cost is undeniable. And the internet knows it. On Instagram, Planned Parenthood's post reads, "We will never stop fighting for our patients." Twitter threads are full of raw emotions, fear, anger, and yes, resilience. You see thousands of people sharing their own stories, using hashtags like #IStandWithJulie and #healthcare is a human right. This isn't the end of the story. Far from it. Several blue states like California and New York are already scrambling to roll out emergency funding to keep services running. Meanwhile, red states are eyeing this decision as a green light to further defund reproductive health centers. Are we about to see a patchwork of access across America? One where your zip code decides your health care. We're heading into a new wave of legal and political fights, and this time, it could be even messier than before. The ruling may have set a precedent, but it also opened up new battlegrounds. Let's go deeper. South Carolina's Republican Governor Henry McMaster celebrated the court's decision, saying it was a step toward protecting the sanctity of life. But reproductive rights groups fired back, accusing the ruling of being less about health care and more about power and control. A Planned Parenthood spokesperson said, "This decision is political, not legal. It deprives people of control over their health. This debate is no longer happening behind closed doors or in hushed courtrooms. It's out in the open." Planned Parenthood's Action Fund is rallying supporters online with hashtags like #StandWithPP and launching aggressive donation campaigns. Their message: don't let this be the end. Let's pause and look at the data. Google Trends show a huge spike in searches for Planned Parenthood Medicaid ruling, Julie Edwards case, and Medicaid patient rights. On Twitter and Threads, reactions are passionate. One user wrote, "Healthcare isn't a privilege. It's a right. Today we took a step backward. And it's not just talk." Instagram is flooded with solidarity posts, protest announcements, and grassroots organizing guides. Young activists are live streaming town halls and planning rallies. TikTok creators are breaking down the legal jargon in bite-sized videos. It's clear, people aren't staying silent. So what's next? Some states are working to buffer clinics with funding. Others are bracing for shutdowns. Federal lawmakers could respond, but it won't be easy in a divided Congress. Bills will be introduced, sure, but getting bipartisan support on reproductive health? That's a battle in itself. Planned Parenthood is urging supporters to speak out, vote, and donate, especially before their June 30th matching gift deadline. The urgency isn't just about money, it's about momentum. The organization knows that the longer the news cycle drifts, the more the outrage cools. But this isn't just about one organization or one decision. This is about a broader conversation on who controls your body, your rights, and your access to care. And you, yes, you, can make a difference. Take a moment to comment below. How would this ruling affect you or your community? Have you or someone you know relied on Planned Parenthood or similar clinics? What do you think our next move should be as citizens, as voters, and as advocates? Make sure to subscribe for more updates and hit the bell icon so you don't miss our deep dive next week. Can Congress overrule the court? We'll be talking with constitutional scholars and healthcare advocates to get the full picture. This is more than law. This is about lives. Stay informed. Stay empowered.